friends in Brazil, it's an honor to be asked to tell you about the highlights from the postgraduate course here in San Diego. I spoke during the inflammatory bowel disease session on immunomodulators and biologics and told the audience that, in general, biologic therapy should be accompanied by immunomodulator therapy to get the best results for patients. I explained to the audience that, in fact, the combination is better at getting people completely off steroids and in endoscopic remission as well as feeling better. That applies for both ulcerative colitis and Crohn's disease. At least in the United States, for Crohn's disease, we have 3 anti-TNF agents, infliximab, adalimumab, and certolizumab, that seem to work similarly, although for the most part we use infliximab and adalimumab. And in ulcerative colitis, we only have infliximab currently, although we expect to have adalimumab approved in the next year for the treatment of ulcerative colitis. I told the audience that one of the things I'm doing very frequently now is checking trough levels of infliximab in patients who are on infliximab, and it helps me to guide whether or not I need to raise the dose especially in patients who are losing response. My colleague Corey Siegel, who's at Dartmouth, talked about safety, and for the most part these drugs are safe, and there's very little evidence that adding an immunomodulator to an anti-TNF increases the risk of infections to any great extent. Obviously in Latin America we worry a little bit more about tuberculosis and other types of infections that are unique to Latin America, especially in Brazil, and those things you know better than I do, how to manage that. David Rubin, my colleague at the University of Chicago, spoke about postoperative recurrence of Crohn's disease and advocated for using either immunomodulators or anti-TNFs to prevent a recurrence in people at high risk for surgical recurrence. And he talked about pouchitis and ulcerative colitis, which is common but generally easily treatable with antibiotics. So we missed you, and hopefully you'll come to DDW next year. Thank you.